In our work on frontotemporal dementia, we're focused on a protein called progranulin. And this protein is kind of unique in that if you lose half of your progranulin, one of the two copies of the gene that we all have, that's enough to lead to frontotemporal dementia by the time you're in your mid-50s in most cases. This is really interesting because it gives us a strategy to treat the disease. We just need to give more progranulin back to the brain. And that's not a trivial thing to do, but it's generally should be easier than trying to block some other function of a protein. So we're working on ways to increase progranulin in the brain, and specifically to do that by gene therapy, by treating mice with a virus that makes progranulin. We can inject that into the brain that then produces progranulin, and that seems to correct a lot of the problems that these mice that suffer from progranulin deficiency have. We found that there is a lot of repetitive behavior and language problems that in many ways mimic a lot of the features of autism. And so we actually use a lot of tests in our mouse models of frontotemporal dementia that were originally developed for mouse models of autism, because they're probing the same brain circuits and they're looking at the same kinds of symptoms that occur in both diseases. So at first glance, it may seem like age-related dementias are completely different at the other end of the spectrum from neurodevelopmental disorders, and they are at the other end of the age spectrum. But what we're learning is that these diseases affect a lot of the same brain circuits, and in a lot of cases, the aging process can be kind of like a regression into the developmental stages. One of the things that's been most gratifying for me is that some of our work now, specifically our work on gene therapy for frontotemporal dementia, has progressed into clinical trials. So things that we found in the lab, in our mouse models, are now being tested in people. And within a few years, we'll know how that works in the patients and really get an answer to whether the things that we set out to do in the lab are actually as effective as they seem to be when you test them in people. And we hope that this can lead to some of the first treatments for frontotemporal dementia.